Okay, good afternoon. My name is Fermin Leguen, Acting Chief Health Officer, Southern Nevada Health District. Today we want to give an update of the coronavirus in our community. So I will call Dr. Mike Johnson, Director of Community Health, and he will provide that for you. Mike, please.
Thanks, Dr. Leguen. Let me begin first, good afternoon, everyone. Let me begin first with providing some case count updates. As of March 19th, the Southern Nevada Health District was reporting 74 confirmed cases of coronavirus here in Clark County. And unfortunately, we're reporting a second death today in Clark County, a woman in her 60s with underlying medical conditions. And as with any loss of life, this is truly a tragedy, and we send our deepest sympathies to her family. As we see more cases in our community, we can't emphasize enough following the guidelines that public health measures and guidelines that Governor Sisolak has outlined regarding social interactions and staying at home. Everyone, I repeat, everyone should avoid non-essential travel and social interactions. And certainly, as you've heard, stay at least 6 feet away from others. We are working with our partners at the state, Health and Human Services, to provide updated numbers daily, and we'll be providing updated numbers also with some additional information in an epidemiological profile on our website daily, similar to what we provide the media each season and weekly around the flu. Our influenza updates. Regarding testing, our Southern Nevada Public Health Lab continues to receive a limited supply of testing resources, and the number of patients tested by the lab, as well as northern labs and commercial labs, is available on the COVID-19 dashboard posted by the state. Some of you may have seen this. It includes tests performed, people tested, the number of positive cases, number of negative cases, the number of deaths, and testing location, age, and gender. So it has a fair amount of information there. The Public Health Lab continues to focus its resources on testing the contacts of confirmed patients, and healthcare providers are being advised to send their specimens to commercial labs for testing. Additionally, we're urging healthcare providers to work with patients to review their symptoms so that those at highest risk are able to be tested. The Health District also received word from FEMA about the availability of the drive-through swab pods that we mentioned a few days ago, and this has been placed on indefinite hold. This is very disappointing news for us as we continue to work with our federal partners to obtain these resources that are greatly needed for not only Southern Nevadans, but all Nevadans. Finally, as we've mentioned, not everyone who feels sick has coronavirus. And we urge people to not go to emergency departments unless it's absolutely essential, continue to practice preventative actions, as we've mentioned before, and stay informed. Both the state website, the CDC website, and our website are updated daily, so lots of good information there. I guess I'll open it for questions.
Are you going to take them right now?
We both will.
Okay, well, specifically, what is the wait time for coronavirus tests being processed?
Well, typically it's been 2 to 3 days, I believe, is the turnaround time that we're looking at. Yeah.
Yeah. The turnaround could be 6 to 7 hours, our lab, but also it could go up to 24 hours when the specimen is processed in our lab. Now, as have been mentioned before, our lab is running with some difficulties in terms of completing the testing for some supporting material. So we are sending some of the specimens to Reno, and that might take a little bit longer, perhaps 2 to 3 days to come back. I also want to mention that commercial labs such as Quest and LabCorp are available for our providers, and that's something that especially our primary care providers should take advantage of. Thank you.
What happened with the swab pods? Why are they on indefinite
Well, that's a question for FEMA. Unfortunately, we don't know. We just received notification last night.
Okay, you were just remarking about Reno. So why is it the Washoe County Health District is releasing more detailed info on patients? Why is SNHD not doing that?
I'm not fully aware of what exactly are you referring to. We are referring the information that we consider that we are authorized to share, and we try to protect the confidentiality of patients and other individuals.
I would just add to that we have a much higher case count. I mentioned as of today 74 compared to what Washoe County has, which is an important factor here because the details of each case, they have to be investigated and all that. So it's been difficult for us to be able to provide these at media time on specific details for all 74 cases. But that information will become available once we get it.
Okay. What can you tell us about some of the specifics on patients, like how many children diagnosed in Clark County? What is their status?
As I mentioned, this information will be available on our website through this EPI profile that we will be providing daily. So we'll have breakdowns by gender, age distribution, and so on.
Just based on that.
Yes, and thank you. And typically, sometime after 3 p.m. daily is when we'll be posting this information.
Just based on our information as of Monday, how many patients have been hospitalized in critical condition since then?
That information will also be available on our website.
Okay. Is the
Are you
risk of
concerned at all that there won't be adequate supplies here in Southern Nevada? And particularly, is the health district doing anything to secure more ventilators?
Yeah, well, the number of ventilators available is a nationwide problem, not just Southern Nevada. Our public health preparedness office, in partnership with the first responders here in Clark County, they are trying to work to the plan, and they are also working with the federal authorities trying to address that issue. But again, the number of ventilators available is something that is hitting all regions across the country.
We're still hearing from healthcare facilities, labs, and residents that they cannot even get through to the Southern Nevada Health District to get their questions answered. What improvements are you trying to make on that?
Okay. Well, we have a hotline available for the public. That is, you have the number with you?
702-759-4636, 702-759-INFO.
Come here because well,
That's
okay, 702
759
759
INFO
info
4636.
436
4636.
36. Okay, yeah.
Okay. You recently received a large batch of tests. How many did you get? Where are these tests being distributed?
Oh, no, I think that's wrong. We were expecting a large batch of tests, but we didn't receive that. That's part of the issue that was mentioned before by Mike regarding our expectation with FEMA and plans that we have with that.
Correct.
Does the large influx of tests change any protocol on who can get tested?
That's the same question. We didn't receive that.
One more question.
Okay.
One more question.
Okay, transmission. Are you seeing any patterns of transmission in the community? What are your investigations yielding? And are you getting any sense that social distancing might be working here?
I mean, we've seen other places that social distancing and staying at home can help. So it's a little too early to answer that question here, but it's certainly the right thing to do. We are looking at geographic distribution of cases, And once we have some of that information summarized, we'll likely be sharing that at some point. But we are looking at that on a case-by-case basis with each of our investigated cases.
What direction are you giving doctors in the community in terms of how to treat their patients, where to send their patients? I'm getting sensing a lot of confusion.
Yeah. Yeah. Good. Yeah.
Okay. What we are telling our providers, especially primary care providers, because I think that they are the ones who are struggling the most with the diagnosis of this condition, is that they should take advantage of the commercial labs. And when they have patients that they suspect coronavirus, and those are patients whose signs and symptoms are not severe enough to justify a visit to the emergency room, they should order those tests through the commercial labs. I also have to say that for most patients with coronavirus, the presentation is typically a mild presentation that can be treated ambulatory, and basically is symptomatic treatment. So the management of the condition itself in an ambulatory setting wouldn't change based on the diagnosis for the individual case. It actually might dictate a different actions from the public health standpoint because of the quarantine requirements or isolation that might be needed, but from the individual perspective of the patient, the test wouldn't really change the management of that patient. One of the limitations that we are running, going back to your question about characterizing the disease in our community, is the lack of testing. So because of that, we have a really limited number of tests done, and most of those tests have been actually performed in patients who have been coming to the emergency room. So most of our patients have been patients that could be characterized as usually severe or close to severe cases. In recent days, we are starting to receive an influx of reports of confirmed cases from commercial labs, and those are mostly from primary care, and that's when you start to see a different distribution on the ages and distribution of cases.
Thank you.